Have you ever noticed a subtle change in your skin, maybe a dark patch or a small bump, and wondered if it's more than just a cosmetic issue? Could your skin be trying to tell you something deeper about your health? Today, we're diving into the often overlooked signs that your skin could be revealing about insulin resistance, a condition that many people have but few recognize early on. What is insulin resistance? First, let's clarify, what exactly is insulin resistance? Insulin is a hormone produced by your pancreas that controls blood glucose, or blood sugar. After a meal, insulin helps shuttle glucose to where it's needed, storing it for later use. But when you have insulin resistance, your body doesn't respond to insulin as it should, leading to high blood sugar and, eventually, diabetes. If you catch insulin resistance early and make lifestyle changes like modifying your diet, exercising, or taking medication, you can drastically improve your health. In most cases, insulin resistance is linked to obesity, with about 70 to 80% of cases related to excess weight. However, it can also result from hormonal imbalances or certain medications. But why should you look to your skin for clues? In insulin resistance, high levels of insulin interact with receptors in your skin, causing noticeable changes. Some of these changes are also linked to elevated androgen levels, which insulin resistance can cause. For instance, high insulin levels can increase free testosterone in women, triggering a series of skin issues. So, what are the skin changes you should watch out for? Acanthosis nigricans. This condition manifests as thick, velvety patches of skin, often mistaken for hyperpigmentation. It commonly appears in skin folds under the arms, on the neck, face, or hands. Acanthosis nigricans is a response to high insulin levels, causing skin cells to multiply. The good news? If you address insulin resistance, this condition can improve and might even reverse. Topical treatments like retinoids can also help, but managing insulin resistance is key. Acanthosis nigricans occurs when insulin levels in the blood become too high, a condition known as hyperinsulinemia. Insulin is a hormone that helps regulate blood sugar, but when cells become resistant to insulin, the body produces more of it to compensate. The excess insulin can trigger the skin cells to proliferate rapidly, especially in areas where the skin folds, leading to the development of these dark, thickened patches. Acanthosis nigricans is strongly associated with insulin resistance, a condition where the body's cells do not respond effectively to insulin. This can lead to an overproduction of insulin, which then triggers the abnormal growth of skin cells. The presence of acanthosis nigricans can be an early indicator of conditions like prediabetes, type 2 diabetes, and metabolic syndrome. Reducing body weight through diet and exercise can improve insulin sensitivity and reduce the appearance of the skin changes. In some cases, doctors may prescribe medications to help control blood sugar levels or improve insulin sensitivity. If you notice dark, thickened patches on your skin, especially if they appear suddenly or are widespread, it's important to consult a healthcare provider. Early detection of insulin resistance can help prevent the progression to more serious conditions like type 2 diabetes. Skin tags, acrochordons. These small, soft growths, often found on the neck, underarms, or other areas of friction, are another sign of insulin resistance. While skin tags can occur without insulin resistance, having multiple tags can be a red flag. Don't rush to remove them with over-the-counter treatments. Some growths might not be skin tags and could require medical attention. The exact mechanism behind the connection between skin tags and insulin resistance is not fully understood, but it is believed that elevated insulin levels and the associated increase in growth factors, such as insulin-like growth factor, IGF-1, may stimulate the formation of skin tags. Studies have shown that people with insulin resistance, particularly those with type 2 diabetes or metabolic syndrome, are more likely to develop skin tags. The presence of multiple skin tags, especially in the areas mentioned earlier, can be an indicator of underlying insulin resistance. While skin tags themselves are harmless and generally do not require treatment, their presence can be an important clue to your overall metabolic health. Recognizing skin tags as a potential sign of insulin resistance can prompt further investigation into other risk factors and encourage early intervention to prevent or manage related conditions. If insulin resistance is diagnosed, lifestyle changes such as adopting a healthy diet, increasing physical activity, managing stress, and possibly using medications can help improve insulin sensitivity and reduce the risk of developing type 2 diabetes and other related conditions. Keratosis pilaris. Also known as chicken skin, this condition causes rough, bumpy skin, particularly on the arms, thighs, and face. It's not specific to insulin resistance, but there is a connection. If you suddenly develop this condition, along with other signs of insulin resistance, it's worth investigating. Moisturizers with urea, lactic acid, or salicylic acid can help manage the symptoms, but addressing the underlying insulin resistance may lead to improvement. Managing insulin resistance through a balanced diet, regular physical activity, and weight loss can help improve the condition of the skin, including Keratosis Pilaris. Reducing sugar and refined carbohydrate intake and focusing on whole foods can help lower insulin levels. While managing insulin resistance is key, topical treatments like exfoliating with alpha-hydroxy acids, AHAs, using moisturizers with urea or lactic acid, and avoiding harsh soaps can help improve the appearance of KP. The next 3 skin-related signs are linked to elevated androgen levels rather than directly to high insulin. Acne. New or worsening acne, especially if it's cystic, can be a sign of insulin resistance. Elevated androgen levels increase oil production, leading to clogged pores and breakouts. If your skin suddenly becomes oily or you experience severe acne, it might be time to consider insulin resistance as a potential cause. Insulin resistance is also associated with increased inflammation in the body. Inflammatory processes can exacerbate acne by making the skin more prone to irritation and infection. Studies have shown that individuals with insulin resistance are more likely to have severe, persistent acne, particularly on the face, chest, and back. Regular physical activity improves insulin sensitivity, which can help lower insulin levels and reduce acne symptoms. Maintaining a healthy weight is crucial, as excess body fat, particularly around the abdomen, is linked to insulin resistance. In some cases, doctors may prescribe medications like metformin to improve insulin sensitivity, which can also lead to improvements in acne. While acne is a common skin condition with multiple causes, its persistence or severity, particularly in adults, may indicate an underlying issue with insulin resistance. Recognizing this connection can lead to more effective treatments, addressing both the skin condition and the underlying metabolic issue. Androgenetic alopecia, pattern hair loss. This form of hair loss, commonly known as male or female pattern baldness, can also indicate insulin resistance. In men, it usually starts with a receding hairline, while in women, it often begins with thinning hair at the crown. Androgenetic alopecia is driven by a combination of genetics and hormones, particularly androgens like testosterone. In people with insulin resistance, elevated insulin levels can lead to an increase in androgen production, including testosterone. These androgens can bind to receptors in hair follicles, particularly those on the scalp, and over time, cause the follicles to shrink. Elevated androgen levels cause hair follicles to shrink, leading to hair thinning and loss. If you're noticing these changes, it might be more than just a cosmetic concern. Pattern hair loss could be a clue that your body is struggling with insulin resistance. Focus on whole grains, vegetables, fruits, and legumes. Limiting intake of sugary foods, soft drinks, and refined carbohydrates can help maintain stable blood glucose levels. Include sources of healthy fats like omega-3 fatty acids, found in fish, flax seeds, and walnuts, which have anti-inflammatory properties and may support overall metabolic health. Incorporate lean protein sources like poultry, fish, beans, and legumes, which can help stabilize blood sugar levels and reduce insulin spikes. Engage in regular aerobic exercise, walking, running, swimming, and resistance training, weightlifting, bodyweight exercises, to improve insulin sensitivity. Aim for at least 150 minutes of moderate intensity exercise per week. Hirsutism. Finally, hirsutism, excessive hair growth in areas where women typically don't have much hair, like the chin, upper lip, chest, or abdomen, can be a telltale sign. This condition is also driven by elevated androgen levels, often linked to insulin resistance. While genetics and hormonal changes around menopause can also play a role, a sudden increase in hair growth in these areas should prompt further investigation. Lifestyle changes such as adopting a low glycemic diet, engaging in regular physical activity, and losing weight if necessary can improve insulin sensitivity. Metformin, a drug commonly used to treat type 2 diabetes, can also help reduce insulin resistance and is often prescribed to women with PCOS to manage symptoms, including hirsutism. Choose foods that have a low glycemic index, such as whole grains, legumes, and non-starchy vegetables. These foods help regulate blood sugar levels and prevent insulin spikes. Incorporate healthy fats from sources like olive oil, avocados, nuts, and seeds. These fats can help improve insulin sensitivity. Engage in at least 30 minutes of moderate intensity exercise most days of the week. Activities such as brisk walking, cycling, and swimming can help improve insulin sensitivity. If you notice any of these signs, don't ignore them. Your skin might be signaling something much deeper. Consulting with a healthcare provider for a full evaluation is crucial. Early detection and intervention can make a significant difference in managing insulin resistance and preventing further complications.